Today we're going to have a look at if increasing your cadence is good for injury treatment and if it can minimize your risk of a future injury. So let's dive in. Hello Run Smarter Scholars, welcome back once again. Brody here, helping you uncover the science so that I can help you train smarter, help you run smarter and make better decisions in your training. Firstly, if you don't know about cadence or how to measure your own cadence, check out a video that I've done earlier. I'll leave that in the description below. Then you can come back to this video and dive into understanding all about cadence and what that has on injuries. But first, we can't talk about the effect of cadence on injuries without first going into a little bit of a reminder about what causes running related injuries. So what you need to keep in mind is that every joint, muscle, ligament, tendon has a certain load capacity. You can gently increase this capacity by strength training or just by building up your training loads in a really gradual fashion, and the body just adapts and gets stronger because of it. But if the training loads and the training volumes become too abrupt and exceed the capacity of what the tendons and the joints and the ligaments can withstand, then that dramatically increases the risk of developing an injury. So just keep that in mind when we're considering cadence throughout the rest of this video, that the relationship between load and capacity is very closely linked between running related injuries. So first we're going to talk about the impact on cadence in causing an injury. And when we talk about the role of cadence in injuries, I think of two main papers. And the first paper comes from Amy Schubert. So this study just had a look at different runners at different cadences, at different step rates, and had a look at the effects that it had on the body. And throughout this study, they mentioned quotes such as, running injuries may be associated with the magnitude and rate of impact force loading during the stance phase of running. Stride length and thereby stride rate or cadence can influence impact shock. So this is talking about that load versus capacity. If we can find a way to manipulate your overall load, then potentially it has less risk of exceeding the capacity of the joints within the body. The paper also mentioned that the knee was the most affected by manipulation of step frequency, so your cadence, a significantly more flexed knee at initial contact, as well as less peak knee flexion during stance was noted when step rate was increased. They also mentioned the up and down force of your center of mass and said that a significant inverse relationship between step rate and center of mass vertical exertion was found as step rate increased and the runner's center of mass exertion was reduced. So to illustrate that, I want to go to a paper by Heiderscheit, and it's going to visually demonstrate what this paper has found. So I've used this illustration in an earlier cadence video, but just to illustrate again, as your cadence increases from 10% less than preferred to 10% more, you notice that your center of mass, the center of gravity, moves up and down a lot more the lower your cadence. And so that comes back to that load versus capacity. It generates a higher load and is less efficient when you're running at a lower cadence. But you can see here that when we separate out the joints and look at the hip, knee and ankle, you can see that as your cadence goes higher and higher and higher, up to 10% above your preferred, you can see that the amount of energy that it's absorbed by the knee is significantly reduced. But the knee is one of the most common locations for running related injuries. And so if you're increasing your cadence, particularly if your preferred cadence is a little bit less and lower than optimal, then increasing your cadence can reduce the overall load on that joint and theoretically reduce the risk of injury. The other paper that I quickly wanted to mention was step frequency and lower extremity loading during running, and they came up with a couple of interesting illustrations and points to make. One of the main illustrations comes from the ground reaction force graph, which mentions that the vertical impact peak, as well as a lot of other vertical ground reaction forces, are minimized when running cadence is increased. And the paper mentions in the discussion that since a 10 to 20% increase in the step rate substantially reduces joint loading, adopting a cadence greater than one's preferred may prove beneficial in reducing the risk of developing a running related injury. So I've just finished doing some filming of running at a low cadence just to highlight a few things, because what we've seen in the research so far, if you run with a low cadence, it can accumulate unwanted forces on the body. And it does so in a few different ways. One, you travel up and down at a greater amplitude. Two, you have the likelihood to overstride. Three, you're more likely to be hitting the ground a little bit harder. Four, you sort of run in a more of a crouched position at mid-stance, bending the knee a little bit more. And five, for some, you might have a crossover step width. And not all of these people have these traits when running at a low cadence, but just increases the likelihood of those traits being present. But increasing your cadence can marginally correct a lot of these traits and reduce a lot of these unwanted forces, as we've seen in the previous studies. So if making these corrections reduces unwanted forces, theoretically we can reduce our overall training loads and bring it under the capacity of the tissues, and theoretically reducing our risk of injury. But on the other hand, if you are injured, increasing your cadence for some injuries might reduce those unwanted forces and bring the training load lower than the capacity of that tissue, and theoretically you could be running at a greater mileage with less symptoms or with the absence of symptoms.
And this was explained really well in that Amy Schubert paper that we mentioned earlier. They had a paragraph titled Clinical Relevance and said that a clinician may consider gait manipulation, such as increasing cadence, in a symptomatic patient who is having pain with running. Pain may be used as an outcome measure to help determine whether the biomechanical changes are contributing to the patient's symptoms. If the runner is symptomatic, the response to the change in gait may be immediate and provide basis to judge effectiveness. So essentially what we're doing is we're trial and erroring an increase in cadence during the running to see if it has a profound difference on the injury and the symptoms. So maybe running longer with less symptoms, or maybe just completing the run with less symptoms. But the effects should be profound, it should be immediate to warrant that change. And why this warrants a trial and error is because every injury is different, every severity is a bit different. I have found personally that pain around the kneecap area, increasing the cadence works really well. It might work a little bit for something like an ITB syndrome, but doesn't really work too much in my experience from, say, a hip flexor injury or a hamstring injury. And so trial and error is usually required.
I can also share a story from myself and a listener of the Run Smarter podcast. This person reached out to me on Facebook and said that he was currently dealing with shin splints. And despite him reducing his running mileage and trying to run really slow, his symptoms continued. And he also reported that while he was running slow, and since he's been running slow, his cadence has reduced to about 168. And so I told him to still keep running slow, but try and increase his running cadence. And then a few days later, I received this message. Very interesting results. Yesterday's 30-minute steady run had a shin pain score of around about 2 out of 10 with a cadence of 168. Today's average cadence was 178 for the same 30 minutes, but pain score on the shin was virtually 0 out of 10. Running form felt much better too. Result. So this is what we're talking about when we say that an immediate result, an immediate outcome should happen when you start increasing your cadence. So if you are currently injured, you can try this out yourself and see if you have the same benefit. So just a few final takeaways. If you find that your cadence is suboptimal, you might want to increase it by 5 or 10% to reduce the overall loads on the body when you're injured and when you're not injured. If you are injured, you can try increasing your cadence to see if that helps with symptoms, but the effects should be immediate and quite profound. If you want to check out a few more videos that I have done on cadence, check them out here. If you have learnt anything or liked anything on this video, please hit like so I know that I'm doing a good job and can help me with future videos that I put out. And lastly, if you have any questions about running cadence or about cadence with injuries, feel free to include that in the comment section below. I'll be happy to reply.